everybody. Welcome to ABA Inside Track, the podcast that's like reading in your car, but safer. I'm your host, Robert Perry Cruz, bringing you a special podcast episode. This is one of our live episodes. Live in the sense that it was originally going to be live. It was a recording that we were going to do for the TxABA conference in San Antonio. Unfortunately, due to the pandemic, we just sort of recorded it at home like a normal episode. But if you were able to go to the online TxABA conference, then you will get to see our smiling faces while we do our talk. But if you didn't get a chance to go, we wanted to release the audio, and the TxABA folks were gracious enough to let us release the audio for this episode out to you. So hooray, you get to hear our talk. Originally, we were going to speak on a different topic, but due to global events, we were asked if we could do something a little more topical. So this episode is on how can we promote social distancing, hand washing? How can we promote systems that will help in crisis times like these related to a pandemic? So we looked at some articles related to social distancing and hand washing, and then a couple related to the green movement to kind of come up with some final ideas. But anyway, you'll hear all that in the final talk. So we hope you enjoy our live, quote unquote, TxABA presentation. Hey, everybody. We are ABA Inside Track. Very nice to see you all. I guess you're seeing us. Unfortunately, we can't see you. So we are very sad, I'm sure as you are, that the TxABA convention has had to go fully online because we were really hoping to actually get to come out to Texas to do our little talk here on promoting pandemic safety measures, or as I wanted to call it, wash your damn hands. So we are going to make the best we can. We're not in sunny Texas. We're in, mildly sunny Massachusetts right now. So we're going to get started with the presentation. So in case you don't know who we are, we're the ABA Inside Track team. We've got a podcast that comes out every week and talks about a topic in behavior analysis. And we're very fortunate for TxABA to invite us to come out to speak with you. We changed our topic a little bit because it seemed a little more relevant to the current goings on. So let's introduce ourselves really quickly. So again, my name is Robert Perry Cruz. I'm one of the hosts of the show. Seated with me, even though we're only about a mile from each other in reality, we've had to kind of separate our hosts a little bit. So here we have, who's next to me?
I'm still here. It's Diana Perry Cruz.
And then in the window below me, in the same town, but who's that?
Jackie McDonald. And I want to admit, Rob, that I love the haircut in that picture down there.
Oh, it's the last haircut I'm going to have in a while. So
yeah, it looks good.
Glad it looks good. My beard's a little fuller.
Those are simpler times.
Simpler times. Yeah. You can get a haircut, not at your house with your Flowbee or whatnot.
I haven't started trying that yet.
No, she keeps threatening, but it hasn't happened.
I'm nervous.
It hasn't happened yet.
Yeah.
So in any case, typically the format of our show, and this is typically the format when we do a live talk, is we take some articles on a given topic and we read them and we analyze them and we review them with you. So you don't have to, or you can after, and then tell us what we got right and what we got wrong, which we always appreciate hearing about. So today on our topic of social distancing and proper hand washing techniques, we're really going to be talking about what research there is on social distancing, which, spoiler alert, there's not a lot from our field of behavior analysis. And we're also going to be talking about hand washing, which, yes, there actually is a lot of research on in terms of from the behavior analytic perspective. And then we'll also be doing a little wrap up at the end discussing what this might mean for, I guess, future pandemics, hopefully the rest of this pandemic. But
we're not going to wrap, though.
We're not going to.
Don't worry.
It's not going to actually be an actual wrap. It's just a wrap up situation. So in case you were wondering what articles we read to be informed on this, I will tell you, and then you will be able to find them yourself. They are 2 articles from The Behavior Analyst. The first is Virtual Rewards for Driving Green by Josh Pritchard, and that was from their 2010 issue. Also from that issue, Climate Change, Meeting the Challenge by Chance and Heward. Heward, I know that name from somewhere. But where? And you might say that has nothing to do with washing your hands, but hold on, wait, we'll get there at the end. Here's our hand washing. Utilizing group-based contingencies to increase hand washing in a large human service setting by Bowman, Hardesty, Sigurdsson, McEvor, Orchowitz, Wagner, and Hagopian from Behavior Analysis and Practice 2019.
Nicely done.
Yes. We also have a very recent 2020 online article from Behavior and Social Issues promoting hand sanitizer use in a university cafeteria by Boardline. And effects of response cost and socially assisted interventions on hand hygiene behavior of university students by Fournier and Berry from Behavior and Social Issues 2012. For some reason, most of the hand washing articles are about college students washing their hands. It's a real problem, isn't it, with our undergraduates?
Those college students.
And then finally, our one social distancing article we'll be talking about, which is from the Journal of Health Economics from 2013, Economic Considerations for Social Distancing and Behavioral-Based Policies During an Epidemic by Fenichel. And if you thought social distancing had just been invented in this past 4 months, I guess you were wrong. It's an old term from at least 2013.
I did not know that.
I really thought it was a recent article. It shows what we know here in America, where we haven't had as many epidemics. And we've sort of just been like, that's a problem for other people. Well, gay. Guess what? It's not. Oh,
we are
boy.
The world.
We are the world. That's who we are, the world. All right. So we've talked a little bit about our objectives already, but Diana, you want to go over them again in your pretty PowerPoint?
Sure thing. Yeah, I had a great time with this PowerPoint, so thank you for noticing. We have 3 objectives for our listeners today, and they basically cover those 3 different topics that you just brought up. So the first one will be that our participants, after listening to this, would be able to discuss the ramifications of social distancing from a behavior analytic perspective. The next would be the participants would be able to identify key takeaways from the behavior analytic research related to hand washing. And then finally, and this is where we sort of stretch things a little bit, participants will compare recommended pandemic safety measures and sustainability measures with respect to short and long-term consequences.
Excellent.
Without further ado,
Oh, good.
I was going to say we're going to turn it over to Jackie. She's taking over.
So I am taking over. I'm taking over the social distancing. And I found this article so fascinating. And I know that it's a beast to get through, I'm not going to lie, as a behavior analyst, because it is from our nearby colleagues, the epidemiologists. So it is not behavioral analytic in nature. But when we did a search on social distancing in the behavior analytic literature, there was nothing to be found. So I called on my good friend of an epidemiologist, and she recommended this article about social distancing. And I think it's fascinating to read what, epidemiologists will say about pandemics and how social distancing and in the lack of social distancing can have an effect, and how we can take that then and think about it behavior analytically. So social distancing is really just a measure that limits contact between people. And ultimately, this social distancing we use as a policy to change individual behavior, ultimately, right? And research shows that when social distancing is practiced, people are asked to be practiced, people may underinvest in prevention and hygiene transmissions. So if you're like, hey, we recommend you socially distance, people are not going to do that just because you told them to. Policies are usually needed to make adherence possible. And that makes sense, right? So if you think about if someone's like, hey, don't see your friends, don't go to parties, and they're like, just don't do it, right? You're probably going to be like, no, I'm going to do it.
Just say
right?
no.
Just say no, right? But if you think about the contingencies there, it's probably more reinforcing. You're probably going to access more reinforcers by going to the party, seeing your friends, than if you don't, if those are reinforcing to you, right? But if there's a policy in place that says, hey, if you go see your friends, we're going to fine you $500, it may be not as reinforcing to do that. Another reason that people may engage in social distancing without policy is the current health state of an individual. So that's going to really influence the incentive to engage in social distancing behaviors. So
you sound like an economics person with that incentives, Jackie.
Thank you. Thank
really
you
good.
Very much. Yes. I am going to quit my job and become an epidemiologist for the next one. Just kidding. I'm not doing that. But yeah, so like for an example, when I was reading this, I was thinking the young may think they're immune to illness, right? So in the beginning of some, social distancing measures, the young will be like, I don't have to do that. It's not going to affect me. It's just going to affect old people. So I'm going to go out and have a huge party, or I'm going to go out and see my friends. Not a big deal. But they may engage in behavior then that is counterproductive to social distancing measures, right? Like we're kind of seeing now where, they might be carriers, like children, for example, carrying it everywhere to every people, to all the people. And so if you're sick, you may be more likely to engage in social distancing, right? Because you're going to have direct consequences. If you do not, you may get sick and or die. And if you don't have any current health problems, then it doesn't seem as plausible, right? So the motivation to respond in social distancing is likely not to be there at that point. Yeah. So it's really important here to note that the solutions that this researcher or epidemiologist uses, he looks at a lot of different equations that I'm not going to talk about and I'm not going to claim to understand.
Aw.
That's
Yeah.
Please go over just a few of them, Jackie. They were so fun to read.
They were fascinating because if you just change one little piece of the equation, it changes everything.
Right.
And that's kind of how he figures out, how social distancing may be effective versus not effective. But he's looking at them that infections will make you sick but not kill you. So he wasn't predicting COVID-19 was going to happen. So the first way that social distancing can be, I guess, marketed by policymakers is called decentralized decision-making. And what that means is that everyone gets to make their own decision on whether they're going to socially distance or not. And according to the equations, this actually makes everything worse, right? Because then some people are social distancing, most people are not, right? Because of the environmental contingencies that are arranged for that behavior. And until things get really, really bad, that's when people will start changing their behavior, right? Because then they'll see it, but it has to affect them first. It's usually this behavior, according to, epidemiologists, is not rule governed for the most part.
It's like the thing I read that said, we're all being graded on the biggest group project ever.
Right. Yeah.
And we're only as good as the weakest link.
Yeah. And it makes sense though, right? Because it's going to depend on your environment. You may not adhere because you need to have money to pay bills. You may need to go to your job. You may not have direct contact with direct contingencies and then not adhere to it because you think maybe it's a scam. We've seen this, right? And if you think about getting infected, that has to feel more powerful and potent than the loss of what they call utility or the benefits of not social distancing to affect the present and future outcomes. So that makes sense, right? It makes sense from a behavioral analytic perspective why people social distance and why people don't is related to the MOs and the reinforcers in their actual environment, right? And so this really does not take into account public health concern, right? On an individual level, people aren't thinking about other people. Usually, when you're looking at decentralized decision-making, they're looking at themselves.
And there's very real contingencies there, right? You're like, I still need to make money because I need to feed my family. Like that makes perfect sense.
Yeah. So the second way that social distancing can be promoted by policymakers is called socially optimal decision-making. And this is when the policyholder takes groups of individuals and separates them and then says, okay, you have to socially distance. You should think about social distancing. You don't have. And you don't have to social distance. And they make that decision based of the contact levels for susceptibility, whether you're going to be infected and whether you're going to have contact with a recovered individual. Again, the only problem here is, though, you're going to see infection is still possible across all groups. So if someone's not social distancing and they visit someone who was social distancing, got sick, and now is recovered, but maybe not fully recovered, then they have a possibility of infecting the entire group. They also show in the equation that when you use this type of model, there's a longer infection period, and that longer infection period will lead to a greater chance for disease across all of the population. So again, not the greatest model here. And again, it makes sense, right? So you're trying to limit contact across groups to optimize everyone's reinforcers, right? And motivation to engage in that response in their specific groups, but you still have a huge risk factor of everyone getting infected and being sick. And then the third one is called the social planner. And this is a policy where you constrain all individuals regardless of health or class. So this is rare. They said that it doesn't really happen often where you just shut everything down. I feel like it's happening right now in some places.
Except for now. Yeah.
Right? And so here, the policy is that everyone should practice regardless of whether you're susceptible or not. And everyone as a group loses utility, loses money, loses, aspects of their life. So everybody, and freedom, right? So everybody loses reinforcers the same to protect the wellness of the group. And they do say there is a large economic issue with this, right? When you shut everything down, as we're seeing now. But they do say that in order for it to be effective, there has to be incentives to do so for people to practice social distancing across a wide variety. And they do say that he doesn't say we'll flatten the curve, but he shows a curve and it is flat. So he did not coin the term we'll flatten the curve, but he's like, and look at this curve, and it just,
look at this flattened curve.
Yeah. So it was just really interesting to look at, how an epidemiologist will view policy related to social distancing and how we can tie that into the behavior of the individual and whether they're engaging in social distancing or not. So I was like walking down the street today and I saw some people all crowded together and people in the cars were driving by screaming social distancing to them, right, at this present time. And you have to think about those contingencies for those individuals. Like, instead of getting mad at them, think about, okay, what are the reinforcers right now for them, right? What are the contingencies they're under? Obviously they're not feeling the direct contingencies of, getting sick, getting infected, infecting everyone if they're not engaging in those behaviors. Mm-hmm. So that's really what I found about social distancing. We should just be doing it.
But it's not as easy as just doing it.
Just do it. Right. No, I'm gonna hopefully bring some of these points back around later in our discussion.
Yeah. All right. Thanks, Jackie. Let's move on to one of the other things that we have been asked to do and we are all striving to do as part of improving flattening our own worldwide curve. It is washing our hands. So social distancing is very new to us, but washing our hands shouldn't be, right? Well, here I'm going to have to turn to my friends at the World Health Organization and their 2009. Who? Yes, that's right.
Who?
We're not doing that. We're not doing that bit. It's not happening. I know you're trying to make it happen. No.
Wait, Rob.
Yeah.
Rob, who?
Yes. Do you know that bit? Do you know where that is from?
Nope, but I'm just joining in. I don't know where any bits are from.
The other thing I like, Rob, is that your timeline skips 140 years.
Well, weirdly enough, the timeline of hand washing actually somewhat follows this. So I thought maybe that, who was saving space, or they're like, we're not going to talk about that. But realistically, when we think about hand washing, as there's signs on the restroom, and it's very important that you wash your hands before you touch food and before you deal with customers. And when you're in a hospital, you should be washing your hands at all these key times. That is not actually... you think, well, that's got to be thousands of years old. It is not. What we think of as modern hand washing, at least again according to the WHO's 2009's guidelines about hand washing, really only goes back about 40 years. Now, if you go back, way back in time, certainly many cultural and religious practices had some component of hand washing. Maybe not with soap and water, but with, say, mud or ash. There were other things that would be used to wash hands. So it's not like hand washing was just invented in the 1980s. That's not what that slide is meant to talk about. But really, some of the earlier folks who were talking about hand washing as something that we could do as a preventative measure. We can wash our hands to decrease the chance that other people get some sort of an infection, because that's the key component with washing our hands. We're trying to minimize the chance that we infect ourselves with whatever, and also that the people we come into contact with are minimized in terms of their ability to get infected by us, because we washed our hands, so our germs are dead. The viruses, are mostly dead, or about as dead as we can make them under our own power.
I don't know. My hands look clean.
No, there's more to it than just looking clean. We'll talk a little bit about that too. So really, hand washing as a preventative measure came out in 1847, or around 1847. And though there were other people, it was really Ignaz Semmelweis, who's sort of like the famous, like the father of modern hand washing. He was working with mothers after giving birth, and there was this childbed fever. And it was, for some reason, all these mothers, there's a high percentage of mothers who would get an infection called childbed fever, and then they would die after giving birth. And he was working in a maternity wing. But a lot of times, what was also really popular in the 1840s was autopsies. So the doctors would go and they'd cut up a dead body, and then they'd be like, time to give birth. All right, let's help this lady out.
Gross.
And so they didn't quite know. Germ theory wasn't really as evolved as it is now. He just sort of figured there's got to be some sort of like a corpse particle or something causing this to happen. So if you wash your hands or scrub your hands in a chlorinated lime solution before working with your patients, I bet this will help. And it did. It decreased the mortality rate of mothers.
Skin right off.
That's kind of a part of it. But it really decreased the mortality rate, like significantly decreased the mortality rate. However, what would happen was the medical community as a whole was not really excited about this. They didn't know about germ theory. They thought it was kind of insulting that this guy was going around telling them you got to wash your hands. hands or do this chlorinated lime with your hands. A lot of them were considered gentlemen, and it was really considered, well, I'm a gentleman. Why should my hands don't get dirty like that? There's a great Stuff You Missed in History episode that actually they just re-released about Ignaz Semmelweis. But really, he did what I think we all want to do, but no is not the best solution.
Pick your nose.
Which is no, he went around yelling at people and calling them horrible names when they wouldn't wash their hands. So as you can guess, most people didn't really love the idea of washing hands. So it sort of became one of those things that would kind of happen, but it wasn't really the modern idea of hand washing didn't really come about till about the 1980s when the United States published national guidelines around the idea of hand washing. And this was
when I was born.
Yeah,
when
within
we
our
were
lifetime.
all born.
This was when it became, the thing that we know it is today. Hand washing was something that everyone should do. It had a lot to do, we knew it could really decrease the risk of getting a lot of diseases. Some of the statistics I was reading about, you can cut down the risk of a gastrointestinal illness or respiratory illness by like 21 or 30 and 31%. Respectively, just by washing hands. So again, it's not that people didn't wash their hands from 1847 to 1980. It's just that it wasn't this sort of everyone washes their hands and washing your hands is an important thing and you must wash your hands at these times. That really is not that old a kind of conceit for most folks. So let's talk about hand washing research, what we have right now. So before we do, let's just take a second and make sure everybody, we go to the next slide? Okay, so these are the articles we'll be talking about. So certainly, really good hand washing is going to be, I think that's the next slide, is good hand washing.
Okay.
Yep. So even though I think we should all know how to wash our hands, let's just really quickly go over it. So good hand washing will be defined as the following. This is from the CDC. It's kind of their little attempt at behavioral skills training without some of the skills training part. Wet your hands with clean running water. Apply soap. Rub hands together until a nice soapy lather appears and do that for 20 seconds. Or you sing happy birthday twice or you do the ABCs kind of slowly.
I actually sing, I'm sorry, Miss Jackson. Ooh, I am for real. Twice.
You got to sing that twice. Yeah, just the refrain?
Yeah.
Okay. What if I want to sing, what's the other hot song that they did? Oh, no, I'm blanking on it.
Hot songs, yeah.
Hey, yeah, that one. Can I sing that one?
You better just time it.
Okay.
Shake it.
So don't forget the backs of your hands. Don't forget to go between your fingers. Don't forget under your nails. Then rinse your hands under clean running water and then dry with a clean towel or the ever popular air dry or rub your hands on your pants is not as good.
Shake
don't
it
do
like
that.
A Polaroid
Yeah, there you
picture.
go. Shake your hands like a Polaroid picture until dry. So that is how to wash your damn hands.
Thank you for
that is
that.
how we'll be talking about hand washing from here on out. So really a lot of the research that had been done had been in a lot of medical fields because there's really a difference between the idea of hand washing, just the way we hand wash when our hands are dirty or there's something gross on our hands, which most of us are probably pretty good at. Like, oh, my hands have mud on them. I better wash my hands. And elective hand washing. And that's really where we as a society tend to fall a little bit short. Because if we don't wash our hands before key times, we do increase the risk that we're going to spread infection. So it's strange. You'd think the doctors and medical centers would be like amazing, like no problems ever. But a lot of the research on hand washing came from hospitals where hand washing was not 100% mastered skill by professionals. And that's not meant to take a dig on anyone. Nobody's perfect at washing their hands. But again, if you can't get it 100% right in the medical fields without a lot of other interventions, it's not surprising that we're not all washing our hands as well as we need to be. So the WHO guidelines really talk about why might people not wash their hands? And some of the thoughts are, well, is it because the skin gets irritated? Is it hard to gather the supplies that are needed? Is it because there's other competing variables? Like, I got to get to my patients. I don't have time to wash my hands. Is it a lack of knowledge that people don't realize how many times or when they have to wash their hands? And certainly we can say what doesn't work. So good intentions, surprise, surprise, do not work to change behavior. Oh,
you know
boy.
where those head you.
Nowhere fast.
No.
This is not a religious podcast. Stop bringing your hell talk into our podcast every week, folks. Every week. It's hell and damnation every week. Certainly making a reduction in the response effort, so making it easier for people to wash hands. You'd think that would help, right? It does not. So making it simple to wash hands, just having hand sanitizer gel does not necessarily make it easier to wash hands, adding more sinks. And then also, again, as much as we all love education and we know education can be an important component, it is certainly not the solution to the why aren't enough people washing their hands problem.
Sounds like we should give up, Rob.
Yes, and that's what we learn. No, of course not. We need to come up with new interventions to help.
Or just do the finger wash. I love
finger
that.
wash.
When you just put your 2 little fingers in the water and then you're done.
Oh no, that's specifically why I define washing your hands.
Yeah.
Because just like I rinsed my hands, like not that you didn't wash your hands, dude. You put your hands in water. That's all you have done. The topography of wash hands is very specific if we want it to have the purpose that we hope, which is minimize infection, or risk of infection, I should say. So again, what works in medicine? Again, according to the WHO. So if your hands are really gross, then you will probably wash your hands. So if everyone's hands were constantly gross, I guess we would wash our hands more often. But that's not realistic. Our hands aren't constantly gross. The other
gross,
times
they're like covered in
like viscera or something. Yeah, mud, dirt. Yeah, then we usually wash our hands.
Okay.
A lot of things that were noticed is that nurses would improve their hand washing when they knew they were being observed by doctors and hospital administrators. But again, as nice as it is to see that there's an improvement, do we really want to feel like there's some sort of big brother watching us and noting if we wash our hands? Probably not. Certainly consistent messaging from the leadership of the hospital about how important it is. So kind of getting the word out. You might think maybe there's some sort of a positive reinforcement there, or at least a negative reinforcement if I don't want to get in trouble for not washing my hands. And a direct sense of support of good hand washing behavior. So again, probably lots and lots of prompting, maybe some feedback that we'll talk about why it might not be the feedback we think of. So there are treatment packages that have sort of been put in place in hospitals to significantly improve the amount of consistent elective hand washing at those key times. So now I'm going to talk a little bit about some of the articles that really looked at, could we improve hand washing in college campuses? Because again, we don't have a ton of how can we improve hand washing for all of humanity articles because they just don't exist. So we're looking at specific small populations. So I have 2 articles that are going to look at college improvement in washing hands in a cafeteria, which again, you'd think wash your hands before you eat, right? That's a pretty simple time to know we should wash our hands. And then Jackie's going to come back in and talk a little bit about washing hands in a non-hospital, but similar, more medical setting. So let's get started, shall we? Now, we already talked about how the patterns of adherence, yep, you can move on, Dinah, thank you. We already talked about how patterns of adherence in hospitals, typically there's an improvement in hand washing when folks feel like they're being watched. So let's see if we can do something else. Is this a matter of, what is it? Is it the feedback that they're getting? Is it negative reinforcement? I don't want people to say something nasty to me. I'm going to lose my job. It's not really clear exactly why that would be. So back in 2012, Fournier and Barry thought, well, what if we can decrease the response effort to hand washing? So what if we put this cool hand sanitizer out because nobody's going to the restroom when they're getting in line to the cafeteria. Nobody's going to the bathroom, washing their hands, and getting back in line at the cafeteria. Oh, rats, now I'm at the back of the line. All the Fruit Loops are gone or whatever you're going to eat. I'm trying to remember what I ate in college.
No butts, no coconuts.
That's right. So what if we made it easier and we put some hand sanitizer there? So, all right, so we're going to put some hand sanitizer there really close by. Hand sanitizer is usually considered to be just as effective as washing with soap and water. You do have to actually rub the hand sanitizer for 30 seconds. Again, that's the definition of sanitizing your hands. It's not just the put that on, do one of these, and I'm out of here.
How about when it just slides right off onto your pants?
Yeah, that doesn't count. That's not the same. Just spraying it on and kind of let it fall and do one of these. Doesn't count. Doesn't count.
It also has to be 60% alcohol and not 60% perfume.
Yeah.
Yes.
But most of them are.
Yeah.
Most of the ones I started looking at the labels once that started coming out, and I was like, I wonder if, and most of them were, most of the commercial products. So they thought, all right, let's get hand sanitizer. Let's see if that changes things, shall we? And then they sort of added some more to just let's put the easy hand sanitizer out. So what they were looking at were in their initial observations was nobody goes to the bathroom and washes their hands before they eat. So they said, all right, what if we put out a poster? It's reminding people to wash their hands. And we put this young lady out who's a change agent. She's going to stand there throwing leaflets at people, telling them how they should wash their hands, which, that poor person, that poor Confederate that they got. It's like, hi, wash your hands. You need to wash your hands. You know you're going to kill people if you don't wash your hands. No, thank you. So already there's some problems with their initial kind of observations of this intervention. And what did they find? Nobody seemed to care. Nobody increased the amount of hand washing. They weren't seeing people use hand sanitizer, like their own hand sanitizer that they brought from their dorm room. So there really was no change just by having someone remind them and yell at them about washing their hands. So time for the intervention. And
I imagine her dressed as a secret agent.
Me too.
No, she was there. She wanted everyone to know. She wanted dressed as a germ or something.
Oh, okay.
I think she was just dressed as a normal college.
I would love it if she was dressed as a germ.
Jumping at people in her germ costume.
Hi, I'm a germ. Wash me up.
There's thousands of me on your hands right now?
It only decreased the number of people who would eat at that cafeteria was the only intervention there. So their first intervention, they took a table, they put it right next to the cashier. So again, when you're in line to get your food, and they put a big hand sanitizer gel station, and then they put like a poster again, like, hey, remember to wash your hands or use hand sanitizer before you eat. They also would sometimes, they had two phases here. Sometimes they'd put that change agent back. And again, she'd be like, hey, don't you want to clean your hands, kill germs, and avoid getting sick? Ugh. Let's rap for a minute about clean hands. No, thank you. But anyway, they did put her out there again. Telling people that they should wash their hands. And then they'd also do the intervention where it was just, here's some gel, it's right there, it's really easy to get to. So again, almost the same intervention. And what they did was look at how many people, they had their observers, I don't know whose job this was, just stand in the cafeteria for, an hour or whatever a day, and look how many people actually took the hand sanitizer and then used the hand sanitizer before they got all their food and then went and ate. So it's a pretty straightforward design. It was an ABCB. And they noticed that, again, nobody was washing their hands. No, still same one here. Nobody was washing their hands in any of the pre-interventions. When they put the intervention in place, however, especially when they had that change agent, they saw 60% of people coming in. It was about 0%. 60% of patrons of the cafeteria were using the hand sanitizing gel. Now, here's the sad fact. When that lady who we're kind of assuming was super annoying and we're all like, oh, please, I don't want to make eye contact with you. When she was gone and it was just, here's the hand sanitizing gel, the number of people who use the gel dropped to 17%.
Wow.
And nobody started washing their hands anymore. So it wasn't like people were using the hand sanitizing gel, but the numbers dropped significantly when there wasn't someone constantly berating them and reminding them to wash their hands. So why might this have worked? Was it a matter of a new step in the chain of their food gathering behaviors? Was it a matter of, economists call it the point of purchase effect? So again, the prompt of what to do is close to where you're actually going to emit the behavior. Why they put the candy right before you leave the store, but now it's hand sanitizer, which you could use instead. Or was it the change agent and some sort of like negative reinforcement of like, oh, this lady's going to yell at me. Oh God, if she'll shut up if I use this hand sanitizer gel. Something like that, which again goes in line with, I think, what a lot of the research in hospitals is showing. So, great. We know there's a way to increase the number of people who use hand sanitizer gel, at least in this one specific location. However, it really seems like these social consequences are a key component. And how are you going to bring that up to scale? We don't have enough people who want to run around like knocking on doors being like, are you washing your hands? Did you wash your hands? Hey, I'm here to remind you to wash your hands. Like, that's not an intervention we're going to implement. So
in the middle of the night, someone's hanging out in your bathroom. Did you wash your hands after you used the bathroom?
Yep. So again, is there something else we can do? So now we're going to move into the board line. So again, more cafeteria. Did anyone switch in the slide?
Oh, no, you
did switch it. Thank you so much. Sorry, folks. So now let's go to the board line article where, again, cafeteria, are we going to improve hand washing behavior? So very similar problem in that individuals were not washing their hands before using, grabbing silverware in this case. So they weren't even getting to the part where they paid the cashier or went to food. So Boardline wanted to say, all right, well, what if we use more prompts? I mean, we all know that there are a lot of hand washing prompts. You see them when you leave the bathroom at a restaurant. Employees must wash their hands, which we hope is not a reminder that if you're not an employee, you don't have to wash your hands. It really should be for everybody.
I've always taken it.
It's an optional. It's optional if you're not working there. I'm going to just walk out of here, no problem, and touch everything. Hey, that sandwich looks great. We're in 3D. All right. So what he was looking at, or Boardline was looking at, was what about using prompts? But really what we always want to use is feedback, because as we all know, giving performance feedback is a successful way to change behavior. Now, the problem that we see when we're talking about something like hand washing, these sort of like big scale social issues, is that it's not really the same kind of performance feedback as if I were actually trying to just teach you, like, hey, Jackie, I'm going to teach you how to wash your hands properly. Then it would be the feedback that we think of, okay, here's the written list. I'm going to show you, you do it. Remember, Jackie, 30 seconds, here's the time. I would give you direct feedback and I'd have you do it and do it and do it until you were successful. When we're talking about feedback to a giant scale, it's probably not going to be effective, and it's not going to be sort of a consequence intervention, because we're really giving feedback to who knows who. In a cafeteria, who's going to that cafeteria? Hundreds of people per day. The feedback is not necessarily their feedback. It's the feedback of other people who've also been there. So when we talk about feedback for large groups, are we really providing feedback as a consequence, or is it really just another antecedent for the people who are going to be present. And that's really kind of the question here. And that's sort of one of the challenges we face in terms of trying to change behavior at a large scale. So previous research, like we talked about, had looked at hand washing and using prompts and then using some sort of feedback in the form of somebody being there. And again, the question becomes, is this just negative reinforcement with our change agent? So could we do something else? Could we take out, the example he gave was people were told after they used the bathroom, feedback of how many people wash their hands. That's even worse than the change agent, because when somebody tells you that feedback, you're saying, who is watching me in this bathroom? I don't want to use this bathroom anymore. So that's the problem. Can we get rid of that whole I'm creeped out by being watched?
We call this the researcher's hole.
Yeah, it's not appropriate, right? I'm sure they got permission, but it's still a little weird. So can we get rid of that kind of awkwardness of the feedback? So in this case, hand sanitizer, can we make it as easy as possible? And can we look at the prompt alone? So just like the signs that are saying, hey, look at these germs. And there's like cartoon pictures of germs, like don't touch the silverware, I'm a germ. Can we use those prompts? And then would using those prompts be different than giving feedback, which was specifically, this is the number of people or percentage of patrons who used hand gel in the past 8 days. So they used the actual number. They had 2 graduate students, undergraduates who were taking data on how many people used the hand sanitizer, how many people came into the cafeteria during their an hour or so they were observing, and then they get a percentage. So we've got our prompting signs is one intervention, and then we've got our prompting signs plus our feedback, where you've got that second poster, and they had fancy bar graphs showing this is how many people used the hand sanitizer. They had another sign with Uncle Sam going, we want you for disinfection.
That's good.
And yeah, pretty good, right? So again, what we'd assume when we talk about feedback, I bet you're all saying, well, I bet the prompts were okay, but I bet the prompts and the feedback were superior in every way. And if that is what you're thinking, you are wrong. I know, sorry, Jackie. Burst in the bubble. So the results, when you looked at hand sanitizer use when nobody was being watched, there was no feedback, no prompts. It was about like 11% of the people coming into the cafeteria. So just by living from 2012 to 2020, we've seen an increase across these different university cafeterias. So let's hope that generalizes to everywhere, right? We're all maybe a little better these days. When you added the prompt, however, you saw a doubling of that. It was about 24% of people who started using the hand sanitizer. When you added the feedback, it was about the same as with the prompt. There wasn't really any change. I think it was like 22%. And we returned to baseline, rates plummeted back to about where they were. So it was like 16% rather than 11%. Some of the same people probably were at that cafeteria. So again, we've got more hand sanitizer gel was being used when the prompts and the feedbacks were in place. They also looked at sort of amount of hand sanitizer gel. So with prompts and feedback, you saw a lot more hand sanitizer gel being used versus another cafeteria where they didn't have any of the prompts and the feedback. So there is a change in how many people are using hand sanitizer gel, but really wasn't a significant improvement just adding the feedback. So if you can just put up some cartoon signs and see like a doubling, you don't need to do all the extra observations and getting the feedback, but also 20% is not that great of value of people washing their hands. I mean, I'm pretty sure you're not going to flatten a curve if only 20% of people use any of the interventions we need. They did a fun online survey after. Most people really liked the posters, said, yeah, it's good, we should be washing our hands. But most of them didn't believe that anything had changed their behavior. I think they just magically woke up and were better hand washers that day. So nobody actually thought that any of the interventions did anything. So again, here's our problem. We don't have feedback that we can necessarily use to the extent that we would want to, or do we? We also have the second problem of people using hand sanitizer gel. Technically, nobody used it for 30 seconds. So really, it was 0% or so across the board, right? Because you have to use it for 30 seconds. It was more like the 10-second kind of, I'm done, grabbing my silverware. And so now the question becomes, all right, the things that we go to improve behavior, we go to our feedback, we use our prompts, they don't seem to be working. But is there any way we can bring some of these technologies up to scale? So Jackie, I'm going to throw it over to you to talk about our last hand washing article.
Yeah, so this one we've actually already talked about before. In episode Grab Bag. Do you remember, Diana?
I think Grab Bag 9.
I think Grab Bag 9 too.
Would have been maybe like 108.
Yes. So we're looking here. Yeah, it was a while back. So I'm going to give you a general overview. We're looking here at the stimulus conditions under which hand washing will occur in both short and long-term situations in this inpatient unit. So they really were seeing hand washing was not great. We're not surprised, right? And so the participants were 171 direct care staff at an inpatient rehabilitation hospital. And so first they just tried like a general education. Everyone wash your hands, the importance of washing hands, right? Hand washing was fairly low. Then they gave everybody hand sanitizer, hoping that it would improve hand washing and use of hand sanitizer. That didn't work. People said that it was too bulky. They didn't have time to put it on their hands. And so then they wanted to look to see whether a lottery, where if someone caught you washing your hands and they put a ticket in the lottery, with whether that would increase hand washing. And so data were collected around times where it was important to wash your hands, such as when you were entering into the hospital, exiting the unit that you were in the hospital, when you had patient-to-patient contact, around meal times and bathroom times. And what I love about this study is they use both covert, not supervisory staff to sneaky look at your hand washing, as well as overt supervisory staff observations. So that's fascinating, right? So what happens when you know somebody's watching you versus when you don't know someone's watching you? I want to be one of those covert people watching people.
The secret shopper of hand
right?
washing.
The secret shopper in the bathroom being like, this is a bathroom time. Are you washing your hands?
I think they put the sinks out. I don't think there was a lot of bathroom
they were in the hallway.
observation. Yeah,
they were in the hallway. Yeah, I'm just being and one thing to note, though, nobody did know that the person, the covert person, the not supervisory staff, they did not give out lottery tickets. So the lottery tickets were only contingent on those overt supervisory staff observations. So they did a total of 280 observations across all of those antecedent conditions. And what they found was not surprising based on previous research. Though the lottery was based on feedback from staff. So they sent a memo out and saying, hey, this lottery is going to be in effect. You can enter into the lottery every time someone catches you washing your hands. And you will get the surprise, right? You'll get this prize.
Someone was watching you. Surprise!
Surprise! Someone's watching you. And so
here's the picture.
The results were kind of fascinating. So when they looked at hand washing during the short term and long term, they found that the lottery was effective at increasing hand washing and hand sanitizer use for those overt observations, but it remained the exact same for the covert observations, which means that it didn't really work, right? I mean,
right.
You should
only when your supervisor's there.
Right? So that means that when your supervisor's not there, you're not washing your hands. And so that was like kind of sad, right? They were like, yes, the lottery maintained hand washing, but only in the presence of somebody watching you. But when nobody's watching you, they were just like, I don't need to wash my hands now. So that's not like super promising for us as a field.
Yeah. It's unfortunate because I think when we're looking at an improvement of hand washing, especially this elective hand washing, it does seem like prompts kind of are helpful. Not enough, I think, to get to where we're feeling there's socially significant improvement. But again, we're not looking at any of these in terms of rate of infection on ward or rate of people going to the health clinic at the university. So, I mean, maybe 20% is an improvement. And maybe it's enough. Who knows? We can't necessarily say. Also, giving people feedback is very useful, but it's not going to be useful at the scale we need it to be because it's probably not functioning the same way it does when we're doing like behavior skills training. It really does seem that the only way to consistently and significantly improve hand washing is a concerted effort to be watching people and telling them that you're watching them all the time about hand washing. Now, again, you can do it more like the lottery, or I think like the WHO guidelines sort of talked about in terms of like, hey, we're all in this together. We're going to do it. We're watching you because we know you're the best. That kind of, so maybe there's some positive reinforcement, but not really, because we're not seeing a change in hand washing. It's more just the cue of who's around me at this time. And, I don't think anyone's purposely not washing their hands. It's just,
they might be.
I mean, maybe. Right. Like, I hate washing my hands. I won't do it unless my boss is standing over me in the bathroom reminding me.
Unless there's some other person at the sink, right? Are they taking a long time? Am I taking a longer time than them? I should probably take a longer time than them.
I guess. And so when it comes down to it, eventually, if we're going to come up with an effective treatment to really improve hand washing at these elective times, it's going to be probably some sort of like fancy amalgamation of a lot of our treatment options. So some sort of like big multi-component treatment, probably with some amount of, how can we make feedback more direct? Can we, make it so that observations are happening more often in a way that we're, hopefully not making them punitive? And I think it really gets to kind of our last the last thing we're going to talk about. So on our show, we typically have a section called Dissemination Station, which is where we kind of take some of the themes that we've been discussing and we talk about how that would be applicable to the wider world, whether it's research ideas, whether it's thoughts for future intervention, whether it's something fun we learned today. So Diana, you thought, why don't we look in some of the green research? Because it's a similar problem in terms of it's huge. And I think all of us feel like, well, there's nothing I can do to change that. Why would I change my behavior? Because it's not going to solve anything. Or it's not going to fix anything. So we really have to come up with creative solutions. So let's talk about that, shall we?
Well, we should let Jackie make the sound noise.
Oh, I forgot. Talk about cues. I'm all off with this distance recording, man.
All right. So I think I have about 5 minutes to summarize this.
You got this, girl.
For you guys. So I did want to make this comparison because I thought that when we think about social distancing, hand washing, pandemic preparedness, or safety measures, I think that there are a lot of overlaps when we think about why people don't do that, as when we think about why people don't engage in sustainable types of behavior, right? And it all boils down to the basics that Skinner talked about long, long ago, right? Which is that evolution really prepared us for engaging in behavior that's going to produce consequences in the now versus consequences in the long term, right? And those consequences in the now are going to be immediate and much stronger than weaker and delayed consequences that might be available, for example, engaging in social distancing behavior, which, as we're all experiencing right now, is really challenging, right? We're trying to work right now in the absence of many of the reinforcers that we normally engage or have access to. And the same can be said for sustainable behavior as well. You're often making some sacrifices now or doing things that are higher effort and lower reinforcement now in order to hopefully access additional reinforcers in the future. So there's some comparisons that can be drawn here. And Chance and Hewer do a really nice job, I think, of breaking down what ways that one might introduce some additional variables into the environment for as related to sustainable behavior, and really breaking it down and thinking about it in terms of, if we were to be able to make these changes, how would they be related to the basic principles of behavior analysis, and trying to really break it down and think about it from that perspective. So I listed the ones that I think are relevant here, so we could maybe briefly discuss it. But basically, if we think about if we're going to make a change, then we need to introduce these in the here and now so that we can introduce them and perhaps make changes to the short-term consequences for behavior, such that we can, in the long run, benefit from the long-term consequences of behavior. So they, in their article, talk about what are some ways that we could introduce additional reinforcement into the short term, right? And they said maybe we could have apps for energy efficient driving or something like that, right? Are there punishments that might be present in the short term, such as taxes for carbon consumption, things like that? Are there EO modifications that could be made, such as reducing effort for engaging in sustainable behavior in the short term, such that you can access additional consequences in the long term? And are there stimulus control variables that could be manipulated? And when you try to break these down, a lot of these types of consequence manipulations just aren't going to be available to us under our current conditions, right? Because we're asking people to shelter in place in their homes, and we have very little control over short-term reinforcers and consequences for that behavior. But I do think that when we think about EO modification and stimulus control in terms of presenting additional educational materials to folks and thinking about their history of reinforcement with regard to rule following, I guess you could say, and making additional sorts of societal and cultural shifts with regard to the benefits of engaging in social distancing or safety measures like hand washing, then that's likely going to be our best bet for now, given the challenges of the environment in which we have to work currently. So it may seem silly to have different memes going around the internet, right, that are going to help us all sort of stay on track and continue to highlight the benefits of hand washing and social distancing and providing little pieces of reinforcement to one another, because what we're really doing in that scenario is producing societal change with regard to how we think about these behaviors and how we value these behaviors, and that will increase our short-term consequences, short-term reinforcers for engaging in these behaviors in the here and now, so that hopefully we can avoid some really problematic long-term consequences.
I'm totally just going to keep sharing memes then.
Do it.
Yeah.
But that's all I got to say about that.
Oh, okay.
Yeah.
Well, I guess that brings us at the end of our... I think that's the end of our time. Again, when we're doing our podcast, we don't time ourselves so much. And when we're actually at a conference, we have everyone looking at their watches like, when is it time for lunch? So we're missing some of our cues here. We just have our timer. So I think we're coming up to the end. So I guess there's not much more to say to folks. Hopefully you found this research interesting. I wish there was some sort of, and we found the article that tells us what to do. We just need to get it out there because it just isn't there. I know I had an idea that I call the poop hand scanner, in which when you go into a restaurant, the feedback is it pretends to scan your hands, and if you didn't use the hand sanitizer, really all it does is measure that you actually touched the hand sanitizer gel or not. And if you did, it comes out green, and everyone can see great job, you're fighting infection. And if you just skipped by it, it's like red, ew, gross, and everyone looks at you. I would like it to be a reinforcement program, but I think it would just end up being another form of.
It would be negative reinforcement.
Yeah, I know. Well, no, I mean that green, bing, look at you, you're a great hand washer. You are. No, not at all.
Or we could all have to wear gloves that are infrared, or our hands could be programmed that they're infrared. And so then anytime we go under light, and all of the germs will show.
Oh, that'd be good feedback too. That'd be helpful.
Yeah. Saw that on an episode of Black Mirror.
Ooh. No, they probably ended really badly. Did everyone try to kill each other or something? Because
I don't remember. I think
dirty
I
hands.
stopped. But this was really fun. I'm really glad. I love how Diana had that idea to tie in the sustainability, because there's where the research is, right? And we can tie that, a little bit. So we can tie in, how we're doing with the here and now, and pulling from what other people have said across, the field and within our own field about hand washing, and how we can, go wash our own damn hands.
Yeah. Well, I guess that brings us to the end of the talk, the show, and everything. We want to thank TxABA so much for inviting us to come out. We're sorry we couldn't come see you in person. Maybe another time. We would love to. We also want to thank everyone who is watching this. Again, thank you so much for taking the time to watch all this virtual. I know that's very tough to have plans to go somewhere fun, and then you just get to watch us on a screen. But hey, we hope you had a good time. And I know if you're interested in hearing more about us, you can find us on abainsidetrack.com. You can find the show if you want to hear other episodes or other talks we've done on our website, as well as on Apple Podcasts, wherever you get your podcasts. And you can certainly email us at abainsidetrack@gmail.com. And I know it has nothing to do with the talk, but I think we all want to say a big, big thank you to all of the folks who are out there either working frontline in the medical field, who are out there delivering food, so that so many of us can kind of just be home. And it's so hard to be home, but we don't have to be out there, helping people every single day. So big, big, big thank you to everyone who is out there making that important change. And for the rest of us, we should just spend our time at home thinking about ways to wash our damn hands, right? Okay. Well, thanks everybody. Goodbye.
Bye.
We want to thank everyone at TxABA one more time for inviting us to the conference. Again, we're very sad we weren't able to go out, but at least we were able to do a presentation for the fine folks out there. And hopefully we'll get to come out and visit with you all in person someday. That would be really fun, wouldn't it? All right. Well, thank you so much for listening to the show. Thanks again to TxABA. And like we said in our talk, big, big thanks to all of the folks who have been working tirelessly to support so many of our sick individuals, or even just us who are at home, by working in the medical field, by delivering food, by continuing to work, our essential workers. So thank you very, very much for all your efforts. This episode's coming out when we are hopefully kind of at the flattened curve other side of all of this. But whether we are or whether we aren't sick, it's still a big, big thank you to our essential workers out there. Well, we want to thank you for listening to the show. If you liked it, why not subscribe to us on Apple Podcasts, Spotify, Stitcher, or wherever you get your podcasts. You can also find these posted on our website, abainsidetrack.com, where you'll also find links to the articles we discussed. These also go out on YouTube with the YouTube subtitling feature. If you'd like to get in touch with us as well, you can email us or find us on social media, whereas ABA Inside Track pretty much everywhere: Facebook, Twitter, Pinterest, Instagram. And of course, like I said, email abainsidetrack@gmail.com. Big, big thanks as well to Dr. Jim Carr for recording our intro and outro music, Kyle Sturry for our interstitial music, Dan Thabit for his editing work, and Hollis Irvin from the Sycamore Workshop for his visual design. We'll be back next week with another full-length episode, but until then, keep responding. Bye!